I just want my patients to use the basics. In the morning, I think you can start with an optional cleanse, then use a good vitamin C, optional moisturizer, and sunscreen. If you want to keep it really simple, just vitamin C and sunscreen in the morning, and then at night, a good cleanser, your retinoid, and moisturizer. So that's just keeping it really bare bones for people who don't have time to use a lot of products or maybe just want the most bang for their buck.
Hi, everyone, and welcome to another episode of #Skinthusiast, the podcast. Today on the show, we have at Tea with MD, also known as Dr. Joyce Park. She is a board-certified dermatologist and one of the very first dermatologists I ever started following on social media. She is a true OG. She's been at this for a really long time, and she has such fantastic advice. Before I worked in dermatology, I would read her blog posts when it came to things like pregnancy skincare and other topics that I really wanted to make sure were coming from someone educated who was going to give me really great, solid advice. And so I really encourage you to check out her blog. She also sees patients in Washington and California virtually at her virtual practice, Skin Refinery. So we will leave all of that down below. But for now, get comfortable, and I can't wait for you to hear from Dr. Park. So I like to start off every podcast asking my guest, what is your first skincare memory?
So my first skincare memory would probably take us back to when I was in college, because I didn't really use skincare at all before that. I was very bad. I didn't even use sunscreen, even though my Asian mother would yell at me to use sunscreen every single day. But I think the first time I purchased my own skincare product and felt really grown up about it was in college when my best friend was using the Fresh Soy Face Cleanser. Such a classic for that time. And I was complaining about how I always forgot to take off my makeup after a night out. And I just needed something easy, something that felt good. And she was like, why don't you just borrow mine so you don't have to buy your own? So I used hers first. I really liked it. I felt really fancy, like I was doing something really great for myself. And then after that, I went out and purchased it. I think it was at Nordstrom. We had a Nordstrom at the Stanford Shopping Center, which I biked to. And then the rest is history.
Who would have thought you're not even regularly taking off your makeup at night after you get home, and now you're such an authority on skincare in the social media space. It's so funny how life just changes and unfolds for you.
It is really funny, and I never would have expected that one day I would be so into skincare, and obviously medical derm conditions as well. And actually a few weeks ago, I was able to meet the founders of Fresh, the co-founders of Fresh, Lev and Alina, at an event in New York City. And it really was a full circle moment for me because their product, that iconic soy face cleanser, was the first skincare product I ever purchased. So it was a really cool moment.
And you're actually one of the first dermatologists I ever followed on social media. And I'm sure probably a lot of the listeners have a same story with you because you were really one of the first to come on social and start educating about skincare. Can you tell us a little bit about your career journey until now? How did you get here?
Yeah, definitely. My career has been anything but straightforward, and I never would have expected to I never expected to start posting so much on social content and have it be such a big part of my life. So the reason why I got on social media was, we'll rewind all the way back to medical school. I was taking a gap year between my second and third years, and I applied for and got the position of a global health media fellowship. So this was the first year the fellowship was being offered, and basically the dean of global health at Stanford wanted to train a future physician in how to speak about medicine and healthcare to journalists and educating the public in a very easy to understand way. So as part of this experience, they sent me all over the world. So I spent a summer at the World Health Organization in Geneva at their press office, learning how to talk about global health issues and how to write about them, and talking to journalists from around the world. And then I took a quarter of journalism classes back at Stanford, and this was through their graduate program with other journalism students, learning how to write articles, learning how to edit and shoot my own videos. And then the latter half of the year, they sent me to New York City, where I was working for Dr. Nancy Snyderman, who was the medical correspondent for NBC News. So for that half of a year, we were constantly looking up studies and reading embargoed studies that were going to be published in the next 2 weeks. And we would pitch those ideas to Brian Williams and the rest of the producing team. And then if our story idea was picked up, then I would go with Nancy to actually film the story. We would write the script, we would film the story, go sit in the editing booth, and then sometimes she would do a live segment on TV. And so we did this every single day for the Today Show, for Rock Center, and for Nightly News with Brian Williams at the time. So that was my first introduction into medical journalism. Super fascinating. And then as part of that year, my fellowship director said, can you please figure out this social media thing? We think it's going to be an interesting way for us to talk to people, educate the public, but it's very new. We don't know anything about it. Can you please start a blog? So that was how I actually got started. It was a requirement for this fellowship. They gave me a little online space on the Global Health website, and every week I would log on and update about my adventures being the fellow and what I was learning and what I was doing. And after that year, I actually purchased teawithmd.com and I moved all my blog posts there. And then I started using my blog as more of a creative outlet. Back then, I was still in medical school. I didn't feel comfortable giving medical advice, obviously. So I was writing more about my experience as a medical student and kind of the ups and downs that may come with that. And as I graduated and when I got into dermatology residency at NYU, that's when I started writing more about skincare and dermatology. And I started Instagram in 2015, slowly grew that and found a community there. And then TikTok came along in 2020 when we were all at home because of the pandemic. I was at home because of maternity leave plus the pandemic. And I started just experimenting with it just as a way to be silly and also just as a way for me to have a creative outlet being stuck at home. And I never would have thought that TikTok would have taken off as well in that way. So it has really been so interesting and such an unexpected ride because I've made so many friends. I've met so many interesting colleagues whom I would have never met from around the world. And I've had a lot of really interesting opportunities as well that have come out of it.
That is so amazing. I had no idea about this internship that you did. I've never heard of something like that before. Do they still have that program?
They do. I haven't checked in a while, but since me, they've had a fellow every year, and I've met several of the fellows. One of them, so the fellowship is actually open to medical students and residents all over the country. And after me, I believe there was Christina Crone, who was from the Midwest, and she was a resident. And then after that, there was Haley Goldbach, who is now also a dermatologist. And after that, there was Michael Needleman, who was from Stanford, who then decided to take a pretty long gap and actually pursue medical journalism as his career.
Wow,
so
that is so
really
cool.
Neat. I think he went back and finally finished med school after a long break.
Mm-hmm.
But there have been a lot of fellows along the way. So there's one every year. And if any med students or residents out there are interested, they should definitely Google or look up the Stanford Global Health Media Fellowship and apply.
That sounds like an incredible opportunity. Did you always know that you wanted to be a dermatologist? At what point in your med school journey did you decide?
Absolutely. I did not know that I wanted to be a dermatologist, and I actually decided somewhat late in the grand overall timeline of medical school. I went into medical school determined to become an ophthalmologist, which is unique and weird in of itself because why would I do that? So it was because I had a good family friend who was an ophthalmologist. And oftentimes when you're going into medical school, your career path is very influenced by mentors that you have or people that you look up to. And so this family friend loved his job as an ophthalmologist, and he thought that I would be a really great ophthalmologist. So I was like, that sounds great. Let me explore that. So going into medical school, I already was leaning towards ophthalmology. I started working in an ophthalmology lab, getting to know all the faculty, and I ended up getting to know all of the Stanford Ophtho department pretty well. I presented at Grand Rounds. I worked on research for 3.5 years with them.
Wow.
And then I took this year off, which was it was eye-opening, mind-blowing. It was so much fun. And the good thing about this year was I could really apply it towards any field. because any field of medicine could benefit from a doctor who can speak about medical issues to the public. And when I came back from that year off, I started doing my rotations, first all the required ones, surgery, internal medicine, OBGYN, peds, etc. And then when I got to and did my ophthalmology rotation, I was really shocked to find that I didn't really love it. And it was pretty mind-blowing to me at the time because it was something I had been preparing for so many years. And I tried to get myself to like it, but there were things about it that just, I didn't enjoy operating while looking through a little microscope. I wasn't the one operating at the time, obviously, but just looking through a little microscope all the time. I could never figure out, I couldn't see anything through the lens. And I just felt like in my heart, it just wasn't the right field for me. And so another one of my mentors that I had met in undergrad, he was actually a dermatologist, and he suggested that I do a rotation in derm. And my first gut reaction was no, because I knew the other students in my class who wanted to go into derm, they, like me, had decided day one, and they were already on this pre-derm track from the very, very beginning. And I was very intimidated by the field because a lot of the students that I knew were like the gunners in medical school. I don't know if that's like a commonly known term, but gunner is like cutthroat, like really striving to be for the top. And I was just really intimidated by that. I feel like that almost discouraged me from even trying a dermatology rotation. But my mentor said, just try it. You might not even like it. See what you think. So I did a rotation and I just fell in love with the field. I thought it was so interesting how everything is visual. Even as a medical student, you walk in and you can see the pathology. You can see the skin condition. And even if you don't know what it is and you can't off the top of your head diagnose it, dermatologists can always do a biopsy and then get tissue confirmation of what that is. And I thought it was so cool that you could treat children, you could treat adults, you could do a whole range of things from medical derm to dermatopathology, which is reading slides. You could do surgery. You could become a surgical specialist and do Mohs surgery. You could do cosmetics. There's just so much versatility within the field, and a lot of it is hands-on, and all of it is very interesting too, and tied to many other branches of medicine like immunology. A lot of it has to do with oncology, and I totally fell in love with the field, and that's when I decided to switch. And this was like a few months before applications were due.
Wow.
So it was definitely a really stressful time for me. I remember reaching out to pretty much every dermatology faculty member in the Bay Area, asking if it was possible for them to work with me on any project, no matter how small. And it was stressful, but then in the end, I feel like I ended up at the right residency program for me. So it all worked out.
Wow. I have a couple questions. When you had this aha moment during your ophthalmology rotation that you realized this wasn't for you and you were thinking you were probably not going to pursue it, were you heartbroken? Were you scared? What were your feelings in that moment?
I was so worried because I just felt like everything I had been working for up until that point in medical school was worthless, which now in retrospect, I know that's not true. And all the experiences I had within ophthalmology, I could still apply to my future experiences in dermatology. But I was just so intimidated by the idea of applying into dermatology that even though I had worked hard for so long, even though I was attending a great medical school, I still felt like I was not worthy of pursuing this field. And a lot of it, I think, is imposter syndrome, and that still persists even today. Even decades after decades of schooling and experiences, I think imposter syndrome is something that I still struggle with. And back then, I remember very clearly when I was deciding to switch, I was having a conversation with some other first-year medical students who were new, and they were trying to ask me for some advice. And I mentioned that I was going to switch into applying for derm. And one of them, she was well-meaning, but she just asked, everybody else who's pre-derm has been preparing for this since day one. What makes you think that you could switch last minute and get in? And I'm sure she didn't mean anything by it. She was probably just curious, but that really was the heart of my insecurity, and it really just sent me into a tailspin. But I actually wrote a blog post about that year of applying to derm because it was such a depressing year, honestly, filled with so much insecurity and doubt. And it's funny because even now, even though I wrote that blog post over 10 years ago, even now when I meet dermatology residents at conferences, they'll come up to me and say, "Thank you for writing that blog post. It really resonated with me because I was feeling a lot of those same emotions during my application year." So I just hope that post can help others out there going through something similar.
We'll link it below too. And I think looking back, I'm in my early to mid 30s, looking back at the age range that you are when you have to make these decisions, at the time you feel you are an adult and you feel prepared. But when you look back later in your adult life, you think, gosh, like those are just kids making these decisions. And it breaks my heart a little bit because those are big decisions that you're making and a lot of stress that you're under. And you're really so young just figuring the world out. So I think it's great that you were able to take your experience and guide some other people who undoubtedly keep, I'm sure, finding this blog post year after year.
Yeah, it's quite incredible that it's still relevant even after a decade. I really did not think that anyone would read it, but I think the fact that people still connect with it really means that those emotions are still felt every year. And I think what you said about how we're making these really big life-changing decisions at a young age, it's totally true. Because where we are at that point where we're choosing our specialty, we're like, what, 25, 26 in general. A lot of people maybe have not met their spouse yet. A lot of people maybe don't have kids yet. And so it's hard to imagine the type of life that you might want to have when you're in your late 30s, 40s, 50s, 60s, and going onwards. And so one piece of advice that I got that I thought was very helpful was look for mentors in a specialty whose lives you want to emulate. So look for mentors whom you think, wow, they have a great life, like they're able to spend time with their kids, like they have relationships. Most of all, do these mentors like their jobs? And that for me was the biggest thing. Like you want to find mentors who truly love their jobs, and then you can see whether or not you can see themselves in their shoes, whether or not you can see yourself in their shoes decades down the line.
That's really great advice. And I want to switch gears a little bit to skincare because I know that's going to be a topic of interest for the audience coming to hear from you. And you have a lot of really great acne content. So I want to start with acne. And if someone is struggling, what can they do at home? What are the initial steps that they can take? And maybe who do you recommend does start at home? And who do you recommend leaves the OTC behind and goes straight to their derm provider?
Yeah, acne is such a great topic because it affects so many people of so many different age ranges, and it's the most common condition that I treat in my clinic, my online clinic. So the type of patient who should start with at-home treatments or over-the-counter definitely would be more of a mild acne patient. So mild acne meaning maybe more comedonal, like having whiteheads, what you think of classically as pimples or zits, or blackheads. If you get the occasional red painful bump, maybe you can try to manage that at home, but I feel like once you start to move to the stage of having several inflamed red bumps, and definitely if it's starting to leave scars, then it's time to go see a dermatologist because we have a lot of things at our disposal that can really effectively treat acne and stop the process before it gets worse. You mentioned some over-the-counter products, like where to start.
Yeah, what are your favorites?
Yeah, so I think Differin is a really wonderful retinoid that you can get over the counter. There's a lot of different types of retinoids, retinols, and retinals. There's a lot of different types of retinoid products out there, but Differin is one of the few that's actually a retinoid that can be directly used as the active form. And it's great for acne. It can have anti-aging benefits. So I think that's a really great one to start with over the counter, as well as a good acid cleanser or product, like a BHA for acne would be great, like a salicylic acid, which can help to clean out your pores, can help to exfoliate and normalize skin cell turnover. Some of my favorite products for that, like I really like the Paula's Choice 2% BHA liquid exfoliant. The CeraVe SA Renewing Cleanser is also a good one. Those are some places that you can just start, like a good acid, a good retinoid, and then of course sunscreen is really important always for any skincare condition. Actually, even if you don't have any skincare conditions, sunscreen is really important. But in acne, you want to look for one that's non-comedogenic and oil-free. And using a good sunscreen can help prevent acne scars from darkening. So it's very important as well.
Absolutely. And one question I get often from followers and patients alike who are using adapalene or Differin for their acne, once their acne clears on this medication, they're wondering, is this something I should keep using? Is it going to give me the anti-aging benefits of other retinoids, or should I try to transition to something different? What do you have to say to those people?
Yeah, so they can continue to use Differin. Differin definitely does have anti-aging benefits as well. Tretinoin, the gold standard, has more evidence for anti-aging just because it's really well studied. But we do have studies that show when you compare them head to head that they have very similar anti-aging benefits in terms of helping to minimize wrinkles and helping to build collagen. So I think Differin is something that they can continue on with. If they have gotten their skin used to it and they like it, they can continue with it. Or if they want to try a tretinoin, they can certainly do so as well and try to get a prescription. But the idea that also you don't want to stop your retinoid once you are well treated, because it can also prevent the acne from coming back. So by having regular exfoliation, regular normalizing of that skin cell turnover, that can actually help prevent acne flare-ups in the future as well. So it definitely is something that I recommend people stay on, even when their acne is clear.
This episode is brought to you by me. Skinthusiast.com is your one-stop shop for all things skin, hair, and beauty. I have countless blog posts to educate you on all the skin concerns and most common skin questions I receive. We also have a complete skincare basics guide on our shop page, as well as the cutest In My Skin era crew necks. If you want to support the show, please head over to skinthusiast.com/shop. And don't forget to rate and review the show wherever you listen to podcasts. And what is maybe a minimum weekly dose of a retinoid that someone's using for acne? Let's say that they were using it 5 to 7 days a week and they have been clear for some time, but they're interested in maybe dialing it back so they don't have to use it every night. Is there a minimum weekly frequency that you would recommend?
I usually tell patients that it's great if you can do it 3 to 4 times a week. And then on those off nights, you can use something different, like salicylic acid pads or a liquid exfoliant or something different, a mask or something with acids that would replace that role of the exfoliant.
Absolutely. And how about for somebody, I have a lot of patients, and I'm sure you do too, they're pretty clear, but they just get that 1 or 2 pimples around their period, on their chin, or in the classic beard distribution. What would you recommend for somebody like that who has that 1 or 2 little hormonal breakout each month and is having a really difficult time controlling it?
Yeah, so hormonal acne is very stubborn, and that's actually one of the most common things I treat is specifically hormonal acne. I think because my social media demographic is a lot of women in their 20s to 40s, hormonal acne is just such a burden for so many of us in that age range. It depends on how often you're getting the breakouts and how much they're bothering you, because we have a whole range of treatments that we can offer for hormonal acne. If you only get maybe 1 a month and it doesn't really bother you that much, you could try using a hydrocolloid pimple patch to bring out if there's any pus under the skin. You could try to make an appointment with a dermatologist to get an injection of Kenalog, which would make 1 or 2 isolated cystic lesions go away within 24 to 48 hours. It works really well. But if you find that this is really every month clockwork, you're getting breakouts and you just don't want any, then a medication that I usually will bring up with my patients at that point is oral spironolactone. And spironolactone works really well for hormonal acne because it blocks the androgen receptors, and it just really can get my patients with hormonal acne actually clear. Now, there's a lot of side effects to it as well, such as birth defects to a developing fetus. It can cause lightheadedness, changes in your period. It can cause some retention of potassium, which isn't like a huge deal in people with normal kidneys. But there are some side effects to be mindful of. So, as with everything, as with any medication, this is a discussion that patients should have with their doctor to see if they would be a good candidate for them.
And if someone, a woman, is interested in this medication, but let's say they want to try to conceive in the next 3 to 6 months, what would be your advice for them? How long before knowing that they're going to try to conceive would you want them off medications like spironolactone?
I generally say 1 month to be really conservative, but the half-life of spironolactone is actually pretty short, and it's probably out of your system within a week to 2 weeks. So 1 month of stopping prior to trying to conceive is actually being pretty conservative.
Awesome. I'm sure you have a lot of worried patients, especially in that age range, who are wanting to treat their skin, but also don't want to compromise any future pregnancies or anything like that. So I think it's always nice to have those conversations and leave those little tips to ease the minds of women who are thinking about starting a family soon. And you recently just had your second baby,
Yes,
right?
yes, we had
Congratulations.
our second baby end of January. Thank you.
Oh, congrats. It's such an exciting time.
It is. It's an exciting and overwhelming time, and I've written about this before on social, but I'm still getting used to my new body and just being patient with myself through the recovery process. And it's really such a journey.
And you've been so open about your C-section and kind of what to expect going into it. What are some things that you have found helpful for yourself going into a planned C-section? Are there any tips you would give the audience?
Yeah, definitely. I actually made a whole YouTube video with a couple of tips for healing from the C-section. But in terms of preparing to go in, I think just giving understanding and setting up the expectation that you're going to need time to heal and arranging for help while you're healing. If you have a planned C-section, just go in with the mindset that you are going to need time to recover. Give yourself grace, be patient with yourself, and then also definitely arrange help for those first 2 weeks at least. For me, I was not bedbound, but it was really hard to get in and out of bed for the first week. And even walking around was really difficult. Having my mom and my husband at home, and then eventually the nanny, was very helpful.
And what about recovery? Any tips for the scar?
For the scar, I've actually been looking into this, but I think so just following along with your doctor's recommendations for wound drugs. So I was given steri strips, and the steri strips stayed on for about 10 days, 10 to 14 days. I actually pulled them off afterwards and just washed the wound with soap and water, allowed it to dry. You could put a thin layer of Vaseline over it and then a dressing. You could also start silicone sheeting if you feel like you're prone to getting hypertrophic scars or keloids. I actually bought the silicone sheets but didn't end up using them because I don't have a history of forming hypertrophic scars or keloids. And then one other tip that I got that I'm starting to do is to massage the scar to prevent adhesions to the tissue below, because that can create even more of an accentuated shelf-like appearance where the scar is very tacked down to the fascia below, and then everything on top kind of like bulges out. So then you get a C-section shelf. Starting massage at the time that your doctor recommends it can be very helpful.
And what about skincare in pregnancy? Let's start with acne in pregnancy, because a lot of the methods we use to treat acne in women who aren't pregnant can't be used during pregnancies. How do you like to approach acne in pregnancy for your patients?
Acne in pregnancy, that's right. A lot of the things that we typically use are no longer able to be used. For example, a lot of the oral medications like spironolactone, definitely no Accutane, no doxycycline as the oral antibiotic of choice for acne. We typically go to things like topical antibiotics. Those are safe for use in pregnancy. Azelaic acid can definitely be used. That's a very commonly used one that can help with redness as well as with inflammation. And also, different types of acids can be used as well. So salicylic acid, lactic acid, those are all safe to use during pregnancy. And definitely, as I mentioned before, sunscreen is still really important for during pregnancy, especially because a lot of women develop hyperpigmentation. So in the form of melasma or darkening of pre-existing lenticos, freckles, sunspots, etc. So using sunscreen is very important.
And where do you stand on chemical versus mineral sunscreens in pregnancy specifically?
I think it is a personal preference. And I think that we do not have data that say that chemical sunscreens during pregnancy is harmful. Now, we do know, according to the study in JAMA, that chemical sunscreen ingredients can accumulate in the blood. We don't know if the level of accumulation is actually toxic. But what I would say to patients is if you feel at all any bit of doubt or any bit of discomfort with using a chemical sunscreen, just switch to a mineral one for pregnancy. And you can even do so for breastfeeding as well if you want to. We have so many great options nowadays that there's no reason to not use sunscreen because you don't want to use chemical sunscreens. I really do think it's a personal preference. And for me, I used both. I used mineral and chemical sunscreens all throughout pregnancy, and I'm using both now during breastfeeding as well.
And what other breastfeeding skincare tips do you have? Because that's another area where I think people just lump it in with pregnancy. And while there is some similarities, there's also some differences in what we can and can't use.
Yeah, so the good news is that while breastfeeding, a lot more ingredients and medications can be used because they're so minimally excreted into the breast milk. And I actually wrote a 2-part blog post on this. The first part was all about pregnancy skincare, and the second part is all about breastfeeding skincare. So I'll send those to you after this recording as well. But in breastfeeding skincare, namely, you can pretty much use almost everything. The idea of whether or not you should do Botox or fillers and other types of cosmetic procedures, that can be up to the discretion of the practitioner. I know most dermatologists may not recommend it, but there's not really any evidence to say that that's going to harm your breast milk in any way. Personally, I would not hesitate to do procedures or even get procedures done on myself while breastfeeding. In fact, I am going to get procedures done on myself while breastfeeding. So that's not really much of an issue. Oral spironolactone may cause a decrease in milk supply, so that's something to be mindful of. So I would not recommend breastfeeding women take spironolactone. About retinoids and retinol use during breastfeeding, I think that you'll find that dermatologists are divided on this subject. I personally think that it's fine to restart using your retinol or retinoid while breastfeeding because it's so minimally excreted in the breast milk that it should not be an issue at all. And I definitely personally restarted using my retinoid after giving birth. There are some other dermatologists who may feel like just to be safe, they don't want their patients to do it. But in the review article that I linked in my blog post, it was deemed to be minimally excreted in the breast milk. So I think that is very reassuring.
Yes, absolutely. Okay, moving on from pregnancy and breastfeeding skincare, you're really good at kind of myth busting. So I wanted to hear from you. What is one skincare myth that you just wish would go away?
Oh my gosh, there's so many skincare myths. I'm like, which one to choose? I think one that bothers me a lot is this idea that you need a 12-step skincare routine to have a good, effective skincare routine. And I feel like a lot of the skincare industry has moved to single ingredient products where consumers feel like they need to mix and match and buy a ton of different products so that they can get all of the ingredients in their skincare routine. And then I get patients coming to me with bags of products being like, I don't know what order to apply these. I can't be applying like 10 layers of things to my face. I'm breaking out. Help me simplify. And so then I really dial it back and I just want my patients to use the basics. In the morning, I think you can start with an optional cleanse, then use a good vitamin C, optional moisturizer, and sunscreen. If you want to keep it really simple, just vitamin C and sunscreen in the morning. And then at night, a good cleanser, your retinoid, and moisturizer. So that's just keeping it really bare bones for people who don't have time to use a lot of products or maybe just want the most bang for their buck. That's what I would recommend. Now, if you want to get fancy with it and start adding in more ingredients, then at least make sure that the ingredients that you're choosing target specific skincare concerns. So if your issue is dark spots, then you should be looking for, in addition to vitamin C, you can look for things with kojic acid, tranexamic acid, especially for melasma. You can look for lactic acid or salicylic acid to help exfoliate. And that's a lot of what I do actually in my practice, no matter what skincare condition the patient comes to see me for, whether it's acne, rosacea, hair loss, I also still help them curate a full skincare routine, because I do think it's very hard to know what skincare products are worth it and would specifically target their skincare needs.
Absolutely. One tip I always tell my patients and audience is shop by concern, not by ingredient. So similar to the way that you wouldn't I don't think you should shop by device or brand of filler. You should find a provider that you trust. I think the same with your skincare. Shop by the concern that you have rather than trying to formulate your own 10-step regimen at home with these single ingredient products. I think we're starting to come on the other side of that now. I think we had a huge rise in single ingredient skincare and long skincare routines. And now we're starting to see exactly what you said. People really are craving that simplification and they want their products to work better for them. So I think we're going to start to see that kind of die down a little bit, but I'm 100% with you. And back to your kind of bare bones routine, that routine is efficacious. So yes, it's bare bones in the sense that it's only 2 to 3 in the morning and 3 at night, but it hits every point that you really need. The 3 most important things you can do for your skin, of course, are sunscreen and then vitamin C and a retinoid. Those are the most effective ingredients that we have. So I love that. I'm a really big fan of the simplified skincare routine.
Yeah, and I often wonder, these people who are doing 10 to 12 step routines, kudos to them for their dedication and investment of time, because I just don't have the time to do a really long skincare routine. And that's something that I am actually working on too, because I would like to expand my routine a little bit more I feel like skincare is also self-care, and it's a form of just taking the time to care for yourself. It's like it should be a time of relaxation, and it can almost be like a kind of therapy. Like at the end of the day, you're taking off your makeup, you're massaging your face, you're doing something good for yourself. I'm trying to carve out a little bit more time for myself right now too in my skincare routine.
I'm trying to do the same. And what is your skincare routine? Your personal routine?
It honestly varies depending on the day, and I'm sure it does for you too, because I get a lot of different types of skincare products and I'm constantly testing different ones. But my tried and true that I still use every day, so in the morning I usually will just splash some water on my face. I don't necessarily do a cleanse with soap. And then vitamin C, my holy grail vitamin C is the Skin Better Alto Defense Serum. I have rosacea and sensitive skin, so that's one that just doesn't irritate my skin, and I like that it gives a little bit of hydration as well. I've been testing a whole bunch of other ones too. Peter Thomas Roth has a really great, also THD ascorbate-based vitamin C that's really nice in a serum type form. I really like that one too. I use my vitamin C, and then after that, if I'm feeling dry that day, then I could put on a moisturizer. During the spring, summertime, I've been using the Clinique Dramatically Different Gel Moisturizer, or sometimes I'll put on a serum. Most of the time, I honestly feel like my vitamin C serum is hydrating enough. So it's only when I feel really dry that I'll put on an extra moisturizer or serum. And then sunscreen, which is honestly a fun step for me because I'm testing lots of different ones all the time, and I'm constantly impressed at all the great and elegant formulations out there. Just last week, I was filming some content testing 2 different viral Korean sunscreens, the Skin 1004 Madagascar Centella, it's like a really long name, Hyaloo Waters Sun Serum versus the Beauty of Chosun Rice Sunscreen. The names are all really long. I forget the full names, but I was testing them both out, and they're both really great. So those are great options for if I want a non-tinted version, if I want to put on foundation or a BB cream on top. But on days when I don't need that much coverage, then I'll just take a tinted sunscreen. I really like the Elta MD, I think it's called UV Elements. And then another great tinted one is actually one that my friend from med school created, Dr. David Kim. He made one called Lightsaver, and it's really nice. I really like the Dermatology tinted sunscreen. I've recently been trying out another sunscreen made by fellow dermatologists called Inzinkable sunscreen from Oath MD. No, Ophthology.
Oh yeah,
Sorry, they
they just
rebranded.
sent some stuff to me.
Yeah.
I have to check it out. I have the box right here.
Yeah, Dr. Mona and Dr. Divya, they made this really incredible sunscreen that has a very nice and elegant finish. And then Peter Thomas Roth has a great one as well that's tinted. And then, see, there's so many. I like can't even list them all. And then I love Isden's Aerofitona
Yes,
Actinica with the
same.
photoliase. That's a really great one. I like the non-tinted one more than the tinted because the tinted tends to be a little orange on me. I don't know how you feel
It is,
about that.
it's very dark. Yeah, it's pretty orange on me as well. But I always find, I don't know, I always find with the tinted sunscreens, they're all workable. You just have to really blend them out. So that's one, but I do find that it's hard for my patients, especially to find tints that they feel meld well with their skin tone. And I think sometimes that can be difficult if you don't plan to put anything on top of it to neutralize the color on you. So yeah, I do think that people find that hard with tinted sunscreens, which is why it's so nice to have so many different options. I did a blog post on different ones for your skin type because so many times people are like, what's your favorite tinted sunscreen? I'm like, there are so many good ones out there, and my favorite might not be your favorite because some are more moisturizing, some are more mattifying, some are deeper tones, some are lighter tones. So it really just depends.
Yeah, I'd love to read that blog post. That would be such a great resource. So please send it.
I try to keep it simple, like only have 5. So I'm constantly updating it with like my newest favorites, but there are so many good ones out there. A lot of the ones you mentioned are on there.
Oh, awesome. Yeah, we're so lucky that we have so many great options nowadays. And I know I was supposed to go through my whole routine, so going on to the nighttime routine. So cleansers, I've been using a couple different types as well, just trying different ones. I've been using the oh my gosh, I'm having a mom brain, I call it. It's the kale spinach cleanser from Youth to the People.
Oh, yes.
That one, it just smells so good. And I'm a fragrance girly. Like, I do like fragrance in my skincare. It doesn't tend to irritate my skin, even though I have sensitive skin. So I love that one. Also, the CeraVe Hydrating Cleanser is always a staple on my bathroom counter. It's just simple, affordable, gets the job done. And for my double cleanse, I use those as my second step. But for the first step, I love a good, rich cleansing balm. Like, it just feels so good to massage it on my face. So the two that I've been loving, the Then I Met You Living Cleansing Balm, it looks a mango sorbet. And it smells so good. And then Elemis Cleansing Balm. It's like
so
so
good,
luxurious. Yeah. I recently opened up a new jar, and it's just even scooping it out and melting it in your hands, it just feels good. So I've been really
It's an experience.
It is an experience. And it does have a heavy fragrance, and it is more expensive. It's a pricier item. But that's exactly the way I think about it, is it's an experience and one that I enjoy, and it elevates my nighttime routine. So I like it. And then after cleansing, then I'll dry my skin. I use the Skin Better Alpha retinoid. That's my preferred retinoid just because I have tried a lot of different retinoids, including tretinoin, and it just really irritates my skin. So I use the Skin Better Alpha Ret. And then moisturizer, I use a whole bunch of different ones depending on what I'm feeling at the moment. But this past winter, I've been using the SkinCeuticals Triple Lipid Restore. The SkinCeuticals Triple Lipid Restore. That's a really great one for winter. And then now that the weather is getting a little bit warmer, I've been using the Clinique Moisture Surge. That's a really good one. Leaning more towards gel type moisturizers. The Neutrogena Hydro Boost is a good one. What else? Number 7 makes a really good Future Renew Peptide Moisturizer. That's really nice. Gets in some of those peptides. And then Peter Thomas Roth actually makes a skinjection line, which has peptides that mimic the action of neuromodulators. So I was using those during pregnancy because you can't get Botox when you're pregnant, and that comes in a serum and a moisturizer. So I've been using that one as well.
Amazing. Last question for you. If you could tell your younger self one thing, what would it be?
Aside from wear sunscreen. I would definitely tell my younger self to wear sunscreen, so that's one thing. But in terms of life advice, I think the one thing I would tell myself is to have confidence in my abilities and to trust my instincts because I feel like just at so many steps along the way, I just doubted myself so much. And it took a long time for me to believe that what I had to say was worth hearing. And it took a long time for me to find my voice. And that's still something that I'm working on even today. So that's what I would tell my younger self. And that's also still advice I give myself every single day now.
I think that's so valid. It's something that I think most of us probably struggle with at some point. And where can people find you, or even if they want to see you as a patient?
So my clinic is called Skin Refinery, and the website is skinrefinery.com. And I'm seeing patients virtually in Washington and California at the moment, and for specific skin conditions. So you can view all of that on the website. And I am still making content online at TEA with MD. So that's on YouTube, on Instagram, on TikTok, and then my blog, teawithmd.com. That's where I put a lot of my recommendations for skincare.
Amazing. We'll link all that in the show notes so that it's easy for everybody to find. Thank you so much, Dr. Park, for taking the time to chat with us today and share all of your skin information.
Thank you so much for having me. This was really fun. And as I'm thinking about launching my own podcast this year, this really gave me a lot of inspiration.
Yeah, and when you do, you'll have to follow up and we'll add it to the show notes for anyone who listens to this at a later date so they can find your show.
Oh, awesome. Thank you so much, Amy.
Yeah, thank you. Whether you're an aspiring dermatologist or you're just skincare obsessed, I think that episode had to be so helpful for you. I know that I learned a lot and I loved talking with Dr. Park. As I mentioned, she's been around for a really long time at Tea with MD. We'll leave all of her information below so that you can give her a follow because the amount of content that she churns out that is just mind-blowing in the skin space is amazing. She has really informative and just quality content. So you guys are going to love following her on social media. Thank you so much for tuning into the episode. If you have a second to rate and review the show, it would mean so much to us. I love to pick reviews now and then to send a little box of goodies as a thank you because I really truly appreciate the time that you guys put into this community. I am so happy you're here. Thank you for listening, and I'll talk to you next week, skin enthusiasts.